Hi guys, today I'm doing another reaction video, but it's not to a TV show, it's actually to a YouTuber that I recently came across who has posted her experience with genetic counseling and genetic testing for a mutation in BRCA1. So I think it's great that she did this because there's hardly any videos that I could find on YouTube or elsewhere about the genetic counseling experience from a patient perspective. So my goal in reacting to this video is just to add in some more information, maybe talk about how her experience might differ or might resemble other patients' experiences. So here we go.
Hi everyone, my name is Abby and I am here to show you my BRCA testing journey and experience. I want to put a huge disclaimer on this video that it is not meant to give medical advice or gene testing advice or anything of that nature. It is only to show my personal experience. For those of you that don't know, the BRCA gene or the BRCA gene is a gene that makes you more likely to have breast and ovarian cancer throughout your lifetime.
So I'm going to just jump in here and clarify what she's referring to as the BRCA gene or BRCA gene is actually two genes, BRCA1 and BRCA2. And we all carry these genes. We all carry two copies of each of these genes, and their normal function is to protect our bodies against cancer. But when somebody is born with one of these genes not working, so they have a mutation in the gene, then they are at higher risk for certain cancers. And both men and women can carry these mutations and can pass on the mutation, and there's cancer risks for both men and women.
I do have familial reason to get tested, but I am not going to include any of that in this video or any family history in this video because I do want to keep the medical history of my family members protected, as that is very personal information. So, starting from the beginning, I am 24 years old. I was told by several doctors that by the time I was 24 or 25, I really should get tested for this gene, as at age 25, that is when screening and preventative measures for breast and ovarian cancer would start to happen if I was positive.
So it sounds like there's a known mutation in some of her relatives, and I don't know if she's at 50% risk because one of her parents or a sibling carries the mutation, or her risk might be a little lower if the relative is more distantly related. But it sounds like there's a known mutation and she's known about it for a bit of time. And her doctors have told her that around age 24, 25 is a good age to get the genetic testing done. And that's right, because women that have a mutation in either one of these genes are recommended to start breast cancer screening at age 25, breast screening with a breast MRI. Other screening starts at older ages, but the biggest implication at age 25 is starting breast MRIs.
2 years ago, I had decided that I wanted to get tested and I was ready. So I made the appointment. I found where I was going to get tested. I searched cancer genetics, and then I live near a prominent hospital system, so I put that name into the Google search and I found it and I made the appointment and all was great.
This is a really good way to find a genetic counselor, just Googling a hospital near you and looking up cancer genetics. Another way is go on the website, findageneticcounselor.com. You can search by zip code, and you can also search by specialty, whether you're looking for a genetic counselor that specializes in cancer or prenatal or neurogenetics, and you can find someone to either see in person or remotely through phone or video.
As the appointment time got closer, I got very, very nervous and freaking out and realized that I was not ready to know if I was positive or negative. I ended up canceling that appointment and kind of just forgetting about everything for 2 years. Recently, I turned 24 and I really just felt like I am at a place in my life where I am more scared to not know the answer than to know the answer.
So it's very common for patients to be ambivalent about whether they want to find out if they carry a genetic mutation that is in their family. And she said she had an appointment 2 years ago, so at the time that she was 22. And especially at that age where it's not going to really have an impact in terms of your screening, it's okay to postpone it. I mean, even at an older age, if you're not ready to have that information, it's okay to postpone it and only have the genetic testing once you're ready to know that information.
I felt like I was in a really good headspace to find out. Before you even get tested, you have to have a genetic counseling session. And that's really just so that they can explain what the testing looks like, what's going to happen, what happens if you are positive, what happens if you're negative, and they go through all of this information.
So it's true that a lot of people go that route. They first have genetic counseling, then they get the genetic testing ordered, and then the genetic counselor gives them their results, and if the testing comes back positive, they usually have a follow-up genetic counseling appointment. It's also becoming increasingly common for patients or their non-genetic healthcare providers to order genetic testing, often through labs that offer direct-to-consumer genetic testing. So I'm not talking about Ancestry or 23andMe, but more clinical grade labs such as Color Genomics or Invitae that we use all the time, but that patients can also use now on their own to order their own genetic testing. But being a genetic counselor, I still think it's very beneficial to most patients to have genetic counseling before their appointment, to really learn about what genetic testing is, what are the possible results that they may get, what the implications are for them and their family members. There's actually a few insurance companies that say that you must have genetic counseling before you have testing.
At that time, if they do think that you are a candidate for testing, then they prescribe the testing and you move forward. It took about 2 days to get to the person that could help me schedule the appointment. And prior to the appointment, they asked for family history. They sent me a document that I can include a picture in here.
It's nice that she included a copy of her questionnaire that she was sent before her appointment. So this is very common. Most clinics will send out a questionnaire either by paper or by email, and the goal of this questionnaire is to gather as much information as we can prior to the appointment so that we can have a more productive genetic counseling appointment. And most of these forms will include questions related to your own health, questions about your obstetric and gynecologic history, and then of course a lot of questions about your family history, what types of cancers there are, at what ages people were diagnosed. And having that information is really important for us. It really helps us choose the genetic testing that is most appropriate to you. A lot of people have the misconception that genetic testing is just one test, but really we know that there's many genes associated with hereditary cancer. There's about 100 genes that are clinically available for genetic testing. So typically we pick and choose which genes are relevant for you based on your own history and your family history of cancer.
They also asked for any family member records for people that had gotten tested, if I could send those in.
That's really important too. If you know that your sibling or a parent or a cousin has had genetic testing, and especially if they've tested positive, please ask them for a copy of their test report to share with us at your appointment so that we know if there's a mutation that's been identified in the family, then we definitely know that there's a specific mutation that we have to look for in you. And you possibly may need some additional testing as well, but it's really helpful to have that report.
And then, even after doing all that family history paperwork, I got a call the day before, and we talked for about 15 to 20 minutes on my family history. And when I say family history, I'm talking very, very in-depth questions about siblings, aunts, uncles, great aunts and uncles, grandparents, even great-grandparents. Obviously, different people have different knowledge about their family, and they absolutely work with whatever you have or whatever you don't have, and that's okay. I actually did have a lot of information about a lot of generations. First, they would say siblings, genders, ages, any cancer, any big medical diagnoses in their lives, and then they would go to aunts on your mom's side, and then uncles on your mom's side, and then aunts on your father's side, aunts on your uncle's side, and you can see how they kind of work their way up with as much information as they can get from you.
So it sounds like she completed the questionnaire and then somebody called her prior to her appointment, and then she's going to have her appointment. So that's a little bit much. Not all clinics function that way. Some clinics might do that. Other clinics just send you a questionnaire and then see you. Some don't even send a questionnaire. So every clinic is run a little differently and every patient's experience is different. And I think it's also really good that she mentioned that genetic counselors will work with you regardless of how much information you know about your family. There are some patients who are adopted or don't know anything about one side of their family, and that's okay. That shouldn't hold you back from seeking genetic testing if you're interested in finding about hereditary cancer risk. We want to try to get as much information as possible, but we understand that in some cases it's just not possible.
Another thing that I did make sure to do before my genetic counseling session was to call my insurance and make sure that I was going to be covered for everything moving forward. So I had the Genetic Counseling Center give me CPT codes, which are codes that reference the type of service or medical treatment that you're getting. So in this case, I got the code for the genetic counseling session, and I called my insurance and I gave them the numbers and asked if they would be covered. And then the insurance company also talked with me about if I were to get tested, how that would look in terms of coverage. Genetic testing can be extremely expensive, so this is a very, very important step. And if insurance doesn't cover you, there are ways to get support and help. And a lot of those genetic testing centers or hospital systems can actually give you the resources that you need to figure out payment, because it's all very confusing and very different for each and every person.
So what she's mentioning about insurance is true. It can get very tricky. And that's another reason I advocate for genetic counseling, because as genetic counselors, we're used to ordering genetic testing all day, every day. That's what we do. So we know which insurances we can send to which particular labs, which insurances we can send to certain labs. We also know if there's specific paperwork that you need for your particular insurance. We know the specific genetic testing criteria that might be insurance specific. So what she did to call her insurance company in advance is a good idea if you're worried about that. You can also call the billing manager at the center where you're going to have your genetic counseling. And in terms of the cost of the genetic testing, that's a good question for your genetic counselor once you see him or her. In regards to genetic testing being very expensive, it's not as expensive as it used to be. It used to be thousands and thousands of dollars. Nowadays, if your insurance doesn't cover the cost of your testing or you don't meet criteria, most labs will offer a self-pay price of $250. So that's all information that your genetic counselor can discuss with you.
Another important thing that I want to make note of is that I did all of my testing during the COVID pandemic. So it did look a little bit different than it would in previous years or previous times. When I had made the appointment 2 years ago, it actually was booked out for 6 months in advance. So that's something to know, that if you do want to get tested, it can be a bit of a waiting game. And it's something that if you are thinking about, it's good to just make the appointment and cancel it later, just so that you have it and you can kind of make your other decisions later. Because of COVID and everything being virtual, I was actually able to be seen the following week from when I called. So it wasn't so much of a waiting game that time. The genetic counseling session was virtual. I didn't really see any drawbacks to the virtual session as opposed to being in person. The other thing that is different about genetic testing during COVID is that it is a saliva test that they send home to you as opposed to a blood test. So I did ask if a blood test was just as effective as the saliva test, and they said that it is just as effective. So I felt comfortable moving forward with that. But again, everyone's needs are different, everyone's experiences are different, so that is just my personal experience.
What she mentioned about the 6-month waiting time is unfortunately true for many clinics. It is getting better over time as genetics departments are maybe getting more efficient, but also there is such a high demand for genetic testing, and there's just not enough genetic counselors to service everyone. So it's true that very often there could be a long waiting period. Now with the introduction of telemedicine, it has allowed us to see patients much faster. And in general, patients really seem to love telemedicine. So that's great. And I think going forward, though we might go back to clinic, there's probably still going to be a lot of telemedicine going on. In regards to blood versus saliva sample, yes, they're both equally good. Genetic testing is performed on DNA that is extracted from white blood cells, which are found in both blood and saliva. So the testing is the same. The only difference is that I find that saliva samples tend to fail a little bit more often than blood samples, meaning the quality of the DNA that they extract or the amount of the DNA that they extract is not good enough to perform the genetic testing. In those cases, the lab always contacts the patient and requests another sample. They would never run a test on a DNA sample that is not of sufficiently good quality. But in general, we don't really have problems with saliva samples, and it is a lot more convenient, and of course it's painless compared to a blood draw.
So I have no idea if this will even get posted, but I just got done with my first consultation for the BRCA gene. It was a lot of information. It was really overwhelming. I already had a lot of information, but just hearing it like as reality was just, it was overwhelming. It was a lot, but definitely overall positive. The genetic counselor was really helpful, really, really nice. It exhausted me. It was like an hour and a half.
Wow. Yeah, an hour and a half is really long for a genetic counseling appointment. Typically, the appointments are probably maximum 1 hour. Sometimes they can be shorter, like 30 minutes or 45 minutes. An hour and a half is a really long time, and there's probably just information overload. As the criteria for genetic testing are becoming looser and looser over time, that means that more and more people will qualify for genetic testing. So the demand is going up, and it's just not sustainable to have these hour and a half pre-test genetic counseling appointments. So I think that in the future, what's going to happen is that we're probably going to provide some sort of information to the patients prior to the genetic testing itself, maybe in the form of a pamphlet or video or very abridged genetic counseling appointments. But really, the bulk of the information will come after the genetic testing results are available, because it's just not sustainable. But in general, I do think it's important to get some relevant information before going through genetic testing.
I got to ask all my questions. It was hard because, like, you know, it's like how many questions do you ask as like a what if, and then how many of those questions do you wait till like you actually have the answer. So it was kind of like, I did kind of ask all the questions as if like, you know, I was positive, because I wanted to have all the information. But I don't know, a lot to think about. One of my questions was, how many decisions or things do I make prior to, you know, the answer of the test? And, you know, they were like, it's really like a personal decision, and I get that. But it's kind of just like, you know, so much unknown. Overall, it takes 3 to 4 weeks to get the testing results. It takes about a week to get the saliva sample sent to your house, and then 3 weeks from when the lab receives it. So that is it for now. I need to go take a nap because that was exhausting. This is the saliva test that came to me in the mail.
There's many different labs that offer genetic testing, and this is one of them, called Ambry Genetics. So most labs will ship a saliva collection kit directly to your home. The saliva kit comes with all the instructions that you need to provide the sample. It's very straightforward, and it comes with the packaging as well to ship it back to the lab.
So when I opened it up, it had a little plastic container that contained the actual saliva test. It also came with an instruction booklet, and it had visuals, so it was really easy to follow, which was really nice. There were also shipping instructions, and then a little card for you to write all your personal information on that you include in the shipment. Now I'm taking the actual test, so you write your name and your birthday on the container, and then you rub your cheeks to help you be able to get more saliva. I'll spare you me actually doing the test. And then you close the lid, which lets this other liquid through, and it's a little mixture. You take that top off, put a new top on, you shake it 5 times.
And by the way, if you see a genetic counselor in person, typically the sample is collected at the end of the session, or you go get your blood drawn that same day.
And then you put it into a biohazard bag. And then you put it into the shipping bag, seal it up, and you're good to go. I just took the test. I kind of feel a little nauseous. I think it's just like the first time that it's all felt like really real. Seeing it all sealed up. It's out of my hands now. I mean, it's always been out of my hands, but like seeing it literally out of my hands, that's where I'm at. Another thing that I want to mention is that at the time that I am making this video, I do not have my results. So I don't know if I'm positive or negative. I don't know if I'll share those results once I get them, but I really just wanted to make this video about getting genetic testing and what it looks like and how it happens. Thank you so much for watching. I really hope that this video was helpful for you. And if you have any questions, feel free to put them in the comments or DM me. I will leave my Instagram below. I hope that you were able to see what genetic testing looks like, what happens during it, questions that maybe you didn't even know you had. I'm not claiming to be an expert on any of this. I really just wanted to make this video because from what I have done in my research, there is nothing else out there like this. So thank you so much. Bye.
I think it's really great that she posted this video because there's really no videos on YouTube like this with other patients that have gone through the genetic testing process and kind of explain what it's like from their perspective. There's of course a lot of support groups for different genetic conditions, but the testing process itself is really nice to see from a patient's perspective, and I'm sure it'll help other patients who are maybe wondering about what genetic counseling is and how the testing process works. So thank you, Abby, for putting this out there. I think it's really great that you're raising awareness. Thank you guys so much for watching. If you enjoyed seeing my reaction to this YouTube video, please let me know if you've come across any other YouTubers that have posted videos related to hereditary cancer syndromes or their genetic testing experience. I would love to react to other videos. And if you'd like to see more videos like this, please consider subscribing. Thank you again for watching and see you next time. Bye.